Hi folks, I have a quick update to my progress for my shoulder replacement surgery. So this video is for those of you who indicated that you would be interested in having progressive updates to let you know what my experience has been. Now, before we begin, there's just a couple things I want to mention. First and foremost, nothing I'm about to tell you is meant to differ or conflict with anything the medical professionals to tell you. I'm simply sharing my experiences, but I will make a few suggestions that are often outside of what the medical professionals will tell you and you really should consider. All right, so let's just recap how I got to this point. So in the earlier video, I mentioned that I was a candidate for a full anatomical shoulder replacement. The option is what they call a reverse shoulder replacement. It just looks different and actually operates different, whereas the ball of the humerus is actually attached to your shoulder and the cup on the humerus. Just the reverse is exactly what it sounds like. I have the full anatomical replacement, so I'm very happy with that because if you have the reverse, usually they cannot change it for the other. But if you have the anatomical and it fails, then they can at least progress to the reverse. So I'm happy with the decision that my surgeon made. Now, that came as a result of years of abuse, is probably the best way to say it. Knowingly, I had a number of injuries during work that began the process forward. I tried any number of things, obviously many years ago, starting with physiotherapy, moving on to things like cortisone shots or Durolane injections, none of which are going to replace lost bone material, and that's just the truth of it. So it got to a point where the pain and the lack of mobility was more than it was worth to try and accommodate. There was nothing else I could do at this point, we'll say. My quality of life, I was missing out on a whole lot of things. It was time. All right, so that's how I got to that point. Now, prior to your surgery, or prior to my surgery, there were a few things that I did and I experienced that I may offer some help to those who are considering going forward with a shoulder replacement. Number one is understanding what's going to take place. So you'll have a consult with your surgeon, presumably. They'll tell you what to do. They'll tell you what the expectations are. But they leave a whole lot out of what you need to do when you get home. At least this was my experience. You may get a lot more support in that way, and I really hopefully hope that you do, we'll say. So here's what I did. First off, educate yourself. All the things that you need to know prior to going into surgery. So what I did, went on YouTube, surprise, and I looked at a lot of professional videos on accommodations you can make to make life easier after the surgery once you get home. And I'll sum it up like this. The best thing you can do for yourself is take one day, one full day out of your life, and put whatever arm it is in a sling and go about your life. And that means everything. Everything from getting dressed in the morning, preparing meals, eating your meals, washing yourself, anything that you think you would, well, anything you would normally do in the day, you need to see just how hard it's going to be to do with just one hand. Now, I'm especially fortunate, at least for this shoulder replacement, that I am right hand dominant, so I was much easier to accommodate all the things I had to do, yet I still learned a whole lot about what you don't consciously even think you do with your left hand. So that is really going to be worth your while. Now, out of that, you will learn that you'll probably have to make a few accommodations for the way you go about things, such as you may need a grab bar in the shower, you may need a seat to sit down on if you don't, well, okay, first off, at least my doctor told me I am not to have a full body shower for the first 2 weeks. And the reason being is they needed the incision to heal without getting wet. After 2 weeks, and that's today, actually, I'm actually just over 2 weeks since the surgery, I am now permitted to have showers. So how was I going to stay clean, at least not smelly, for the last 2 weeks? So you have to figure that out. I'm not going to make suggestions on how about cleaning yourself, but I'm sure you can do that for yourself. So those things need to be considered. I will tell you this right up front. It helps to have someone with you for that first 2 weeks at the very least. I tried as much as possible to do everything for myself, maybe a sense of independence, and maybe I just didn't want to burden my wife for things that I could accommodate on my own. So wherever possible, I dressed myself, but there were still a few things that are really hard to do one-handed, like putting on a sling. Most of the time, I had to have my wife, and I continued to do so, ask her to help me put on my sling. I can do it, but it's just much easier to have her do it for me. Everything else I'm now able to do for myself. So those are the things you want to do prior to the surgery. Now, this is also my experience. I can't say it'll work for you when your area and whatever your preparation for surgery is, but the hospital pre-administration called me some weeks before the surgery and went through all my list of medications. Now, I have no prescribed medications. I'm otherwise healthy, I guess, except for the shoulder and other arthritic pains that I have. But I do take a number of supplements, as do a lot of people. They may ask you what supplements you take. Well, they will, at least in my area. And there's a good reason for it that I wasn't even aware of. Some supplements, while they serve a useful purpose, can actually work against healing. Some supplements can cause excessive bleeding post-surgery. I was not aware of that. So you may be asked that, and you can look online to see what those are and see if there are things that you're taking. And also, there are things that medications that may conflict with what they want to do. So, it's just an onboarding process, I guess, getting ready for the surgery that the hospital goes through. Day of the surgery, all went through the process, went to sleep, woke up, I was in recovery, my arm was in a sling, and I had a nerve block. If it's an option for you, it wasn't really, it was strongly recommended, and they do have to approve it. If it's an option for you, you want the nerve block, you really do. Basically what happens is prior to the surgery, they will place a needle in through your neck, shoulder, somewhere, and block the nerve from all sensation. So I lost all movement of my arm, all sensation right down to my finger. It took about 8 hours before that came out. You can start to, it's like numbing, like when you get a nerve block not put to sleep, but when you're having a filling or an extraction or a root canal or anything else, it's kind of like that. You feel nothing, you sense nothing, but then it starts to come out and it starts with the tingling, and eventually you can, feel things. Well, same thing, tingling in my fingers, movement in my fingers slowly returned. So that's a godsend, really. It is for pain management. Now, I spent 24 hours in the hospital. I came home. I think that's pretty much usual. I don't think people spend usually more than that anymore for shoulder replacement, often less, I'm told, and certainly less with other replacements like a hip or a knee. But yeah, 24 hours and I went home. Pain management. I'm going to tell you this now, regardless what anybody else says, you want ice on your shoulder as soon as you possibly get it. In fact, if you can talk well enough, and I'm sure you can after you come out of the sedatives that they give you, ask for ice while you're in the hospital. Unfortunately, they did not have that for me to do, and I did not get ice on my shoulder post-surgery until I got home. As a result, I experienced an issue that you hopefully won't have to experience for yourself, and that was excessive swelling in my arm. There's going to be a lot of bleeding down into the arm from the surgery anyway. That's to be expected. But for me, it got to a point where all the bleeding down into my arm and the swelling as a result caused my arm to go completely purple. I lost my fingers, all but disappeared. They became sausage fingers, and my hand was twice the size it was. And I ended up being seen by my family physician for concern that the swelling was going to cut off circulation. The good news, it was not that bad. The only reason, well, I can't say this for sure, but the only reason I believe it didn't is because prior to surgery, I had done the research and I had made arrangements to secure an ice machine. And this is the one thing I'll say is an absolute. You have to have ice at home. Now, yes, you can get by with frozen peas. Yes, you can get by with bags of ice or something else. But if you want to really make life a lot easier for you, you really should look into ice machines. And anyone who provides it, we're very fortunate in our area through a donation of a private citizen. The hospital will give you, not hospital, you have to go to a provider. They will fund the ice machines for you. You still got to buy ice at the grocery store or the gas station for it. But at least the ice machine was provided for me. Let me just show you the one I have. I'm not going to demonstrate it, but it's a two-piece affair. It's basically a small bucket where you can see the coiled around tubes, and inside is just a small pump that will circulate ice water through those tubes. And this contraption is what wraps around your shoulder and the top of your chest and down your arm and attaches to those other tubes. And there's a constant circulation of cold water. The only caution is that you have some type of a shirt or something, maybe even a towel laying over the incision site. It's not like having pure ice on your shoulder. It's not, the concern about frostbite is not as severe as it would be. You do have to think about that if you are using ice in a bag or anything else, is that you don't have the ice on for too long. Now, the other thing is, prior to the generally accepted recommendations for ice, it's not 20 minutes on, 20 minutes off, or 5 and 5. There's a lot of different combinations of it. This you can leave on. You can actually leave it on. So you can go to bed if you want and have that ice circulate all night long. Now, the ice probably won't last that long, but you can have cold on your shoulder for an extended period of time, and it really is nothing short of a miracle in terms of pain management and swelling management. And a lot of the pain does come from the swelling. In fact, I really don't remember experiencing much pain around the site of the incision, other than itchiness. That's another issue. But where the joint has been attached and the bone removed inside, I really did not experience. The pain that I experienced was primarily from the swelling. Now, the next component of pain management are the medications that you are recommended to take. I was recommended to have a Tylenol around the clock to a certain amount and it's so many hours. I'm not going to suggest what it is because I know other jurisdictions may do it differently. I know other jurisdictions will also suggest you alternate with other than Tylenol, such as ibuprofen or naproxen. Those are anti-inflammatories which will keep swelling down. There is some debate in some jurisdictions, including mine, that whether or not they complement each other or work against each other. I think, in fact, most people will recognize they complement each other. But again, you take your doctor's direction on that front. If you're allowed, and you can take either of the other two anti-inflammatories, it greatly reduces swelling and pain around the clock. The backup, and I mean this just as a backup, is an opioid. So I was prescribed Dilaudid, and I took it once. And it just doesn't make for a very pleasant sleep, at least for me. I did not want to make Dilaudid a regular thing, so I took it once, and that was because of the pain associated with the swelling. I come back to that a few times. Not the pain, any pain really associated to the shoulder itself. Now, that's not to say I didn't have discomfort and I don't have pain. It's just not enough to keep me either from sleeping or functioning during the day. All the pain I had, or all the pain that was concerning, came directly from the swelling. Again, I point that out because if you can avoid the swelling, you're much better off. All right, so where am I at? 2 weeks in, I have returned to my doctor. I've had the staples taken out, and that's about it. I am still in a sling for another 4 weeks before I start physiotherapy. So the only motion I'm allowed to do, and it is recommended, is that I do take my arm out of the sling a couple of 3-4 times a day. And the range of motion is limited to just basically what you would consider an arm curl. That's it. No movement of the shoulder. In fact, you don't even want to try that. Trust me. On occasion, I bumped my arm or my hand or in certain directions outside of the prescribed range of motion, and the shock of pain was significant. Went away quickly enough, no damage done, but you want to avoid bumping and doing those things accidentally because you'll feel them without question. So just a small range of motion. That's what I'm going to say. Oh, yeah, one huge thing, and this is both pre-operative as well as post-operative. I came to a point where I could no longer sleep in my bed, and that's really unfortunate. I'm a lifelong side sleeper, and side sleeping was just impossible for me due to the pain. In fact, in both shoulders, but primarily in the left shoulder. So leading up to my surgery, I began sleeping in my recliner. I have a Lazy Boy recliner, and I began sleeping there. After your surgery, you can sleep in your bed, but you will be sleeping on your back with a lot of pillows to support your back, your shoulder, and under your knees. That works. But if you have a recliner or can get a loan of a recliner from somebody, it makes life so much easier. It really does. And once again, you want to spend a few nights in the recliner, if you're not already, getting used to what it's like to sleep in a recliner, because it's a different skill. If you're a back sleeper or a side sleeper like I am, it's a different experience sleeping on your back. You do got to get used to it. Plus, if you're an aging man like I am and you have to get up and go to the washroom, you got to know how you're going to get up and go to the washroom one-handed in the middle of the night. I know, small things, details, but things you may not think about unless you experience them yourself. So again, I'm just trying to share my experience. Okay, that's basically all the information I have for you over my experience in the last 2 weeks. As you can see, I'm still in the sling. I'm not in any real pain, a little bit of itchiness from where the skin is starting to retract from the swelling, and that's about it. My next step will be again in 4 weeks when I begin physiotherapy. Whether or not I wait for the next 4 weeks to give you another update, we'll see. And if there's any big changes, I'll certainly come back. But at that point, that's the next movement or the next stage in the healing process. So I think it's fair that I wait until then to give you an update on what's taking place. I would encourage you, if you have any comments or questions regarding my progress or anything that I have learned that I can help you with, put those comments in the section below. But until next time, folks, get out and explore and take that path less traveled, because it will make all the difference. Bye for now.